educate the mother and we need to motivate them. We have done quite well since 10 years ago. 10 years ago, there's only less than 1% of women were breastfeeding, full breastfeeding for 6 months. Now we've got 25%. So we continue to motivate the mother to breastfeed.
Breastfeeding is not supposed to be painful forever. As long as you get help earlier, the better. And breastfeeding is supposed to be, comfortable throughout your how many months or how many years you would like to breastfeed.
Great, thank you.
Not to say right or wrong, it's more like how we want to recuperate during this period of time so that we can have a better life, better health, physical state for breastfeeding for a second child or a third child. Yeah, so I think this is where that TCM comes into play.
So is it necessary to wake a sleeping baby for night feeding, especially during the first few weeks?
Of course. So babies, newborns, they are made to wake frequently to feed at least 8 to 12 times every day. And many moms, they are confused, like 8 to 12 times. Sometimes it can go more than that, and it's normal as long as baby is peeing well, pooing well, and have stable weight gain every week. So this 8 to 12 times can be a little bit misleading. Sometimes it can go more than that. And especially babies with jaundice, they are extra sleepy. So we need to wake babies up to feed newborns every 3 hours so they can get the calories that they need to grow and thrive. And at night time as well. So when we talk about waking babies up every 3 hours, these also include night time, especially babies with jaundice and even medical conditions that contributes to low or slow weight gain. You need to be fed frequently. They are made like this. This is normal for them. So especially newborns, they need that to survive.
Alright. So the next one, I just want to find out, is it true that breastfeeding can actually create a strong bonding, especially emotional bonding between mother and baby? The commonly being said by most people around.
Mm-hmm.
How true is that? Yeah.
Understand. So let's talk about the science behind it. Breastfeeding is a lot about hormones, like what Dr. Goh mentioned, right? Oxytocin and prolactin. Every breastfeeding mom, I will encourage you to always understand how oxytocin and prolactin works. So as mommy breastfeed baby, and we would always recommend mommies to breastfeed baby skin to skin. So mommy topless, remove your bra, and baby just with a diaper on. This and baby and mommy skin to skin, it also activates the feeding reflex and motor reflex for babies on mommy's chest as babies latch. And as baby suckle on the nipple, it actually stimulates the nipple and releases oxytocin for the mommy. So mommy is there cuddling the baby, feeling calm, and the oxytocin releases. And this is the time that many moms will find that their nipples, their breast starts leaking milk, right? Or this letdown is stimulated by the oxytocin release and working together with the prolactin. So there's a story that I want to share as well. Back then, I was 5 to 6 months postpartum, and I attended a concert. So, can you imagine 5 to 6 months after postpartum, I was so happy, can attend concert, have fun, sing with my friends, and with that happiness, during the concert midway, my breast starts expanding because I was so happy, and I know that this is oxytocin in the work, right? This kid starts getting full, and oh my god, I need to find a place to pump and everything, but it's also difficult during concerts. So can you imagine, the mommy's happiness state also matters for milk production. And with oxytocin release, it also helps with your milk supply and milk production, if that's what many moms are concerned about their supply. So yes, feeling happy, feeling a calm state of mind is also important for milk production.
So oxytocin is also known as the love hormone. Have you heard of it?
Yeah.
So we can use oxytocin as a spray and spray in your tongue, and it has an effect, a very positive feeling of wanting to be close to someone. So it has been used for husband and wife relationship to create better bonding. So this is oxytocin. So oxytocin is a very wonderful hormone. It also helps the uterus to contract. So when we have a mother with bleeding problem, hemorrhaging, we use oxytocin to try and stop the bleeding. The other thing is also new knowledge. It's about bonding. Right? So you describe bonding as skin-to-skin contact, and also being close to the mother's heart. Because when the baby is in the mother's womb, right, she cannot even hear his or her own heartbeat. She hears the mother heartbeat. So there's this memory of the mother's heartbeat. So when you put your baby close to your arm, then it reminds the baby of the original environment. And the original environment is the best environment for the baby. The other thing about bonding, again, this is something new I've learned. Last few years I've been learning about water, about therapeutic water or healing water. I work with scientists from Russia and from America, and we were using water to heal. And there's a scientist called Masaru Emoto. He showed that water has a memory and has an emotion. He showed that by taking water crystals just before it freezes. So you can say something very nice to the water, and then you look at the water crystal, it forms beautiful crystals. And you can say something very nasty to the water. The same water, you take a drop of the water out, and the water becomes very distorted. Right? So there is a relationship between emotion and water. We just understand that. It's not scientifically proven, but there's some that water has a memory and emotion. Now just imagine this. Most of your body is water, 70% is water. Your baby has been immersed in your water, and her water comes from your water. So if you talk about water having emotion and relationship, you cannot imagine what kind of strong emotion is going on between you and the baby. But when the baby is delivered, right, that water is cut off. So the only time when the two water reconnect is when you're breastfeeding. Because 90% of your milk is water. So can you imagine, now you're reconnecting your water that the baby was formed back to the baby. So this is the bonding that I understand. So when I thought about it, I thought, wow, this is the bonding. If water really got emotion and a memory, see how the baby will feel when the water is coming into the body. You feel that it's at home. You feel that it's with the mother. You feel at one with the mother. Some imagination. You think there's some effect on the bonding when they're breastfeeding. That's why I want to encourage mothers to breastfeed for as long as possible because of this bonding. Because we in Singapore, because of the sort of career that you all got to go in to become a breadwinner for the family, you got to spend time away from your children. And this, I think, actually quite detrimental to the health of the children. That's why there's a lot of stress. All the stress that we face in society, it's all channeled down to the children, right? And they cannot tell you, they cannot complain to you, and they bottle it all up. So today we're facing a lot of stress among the youth and among the children. So if you think about it, that breastfeeding is a good opportunity, a good chance for you to continue your bonding. Do you agree with it?
Yes, I agree. And I also want to add on to that, the bonding with baby. So when baby is, in the body for 9 months, right? After baby is delivered, this is what we call baby and mommy goes through this period of 4th trimester. This is when, responsive feeding is important. Responding to your baby's early cues is important as well. And when baby is placed on mommy's chest, the areola, there's this gland, what we call the Montgomery gland. Yes, and studies have shown that it has the same smell as the amniotic fluid.
Oh.
So that's why baby use a sense of smell to try to find mommy's breast to latch, and to them this is their home. That's why it's very common for baby to always want to be with mommy. Yeah, and many parents will think that baby is their milk is not enough. There's perceived low milk supply misconception. It's just that breastfeeding serves not only for nourishment, it also serves for love, security, and bonding with mommy. Yeah, and just now you mentioned around parents have to go back to work, and breastfeeding connects back with the baby. Yes, it works like that too, because many times when mommy and baby is separated, because mommy has to go back to work. After work or after a long day, baby also goes through his or her own long day with the caregiver, right? When they connect back together, many of them, they will reverse cycle their feeding pattern. This means that they will feed lesser during the day, and then when they wait for mommy to come back, they will latch on mommy more during the evening and night. It's for them to reconnect back to each other, and this is what we call reverse cycling, which is a normal phenomenon. But many parents will find that, why is baby latching me throughout the night? It's so tiring and everything. But it's a normal phenomenon for babies. That to go through that. So
yes. Agreed. I think the biggest problem we face is mother going back to work. Because she's got to go back to work, and she finds no point, carry on with the breastfeeding. So we have to get the workplace, the corporation to cooperate with this is all about the health of the worker, to provide facilities and encourage the breastfeeding mother, to encourage and to support them when they come back to work. So this is not happening, as you know. So these are the sort of direction we should be moving towards. And as long as we work towards it, society will one day become more and more enlightened, more and more aware that these are all values we should be encouraging, should be serving. At the end of the day, it's going to make you a better nation, make you a more inclusive nation, a better citizen, and more more consideration for each other, and respect start with the family. So all these are very important values that we are actually trying to sort out how we can one day make it come true.
Thank you, Jessica. Thank you, Mr. Eliza. Right. So, touching just now, you mentioned about myth and fact, right? Can you actually shower during confinement? And they always have this saying that, you are pregnant, right? After delivered, you make sure no aircon. So, you want to tell us more about, is it true?
Okay, I think there are a lot of myths regarding confinement practices. So first thing, can you shower? Of course can. Okay, because in Singapore, 33, 37 degrees. So we cannot do shower throughout the entire month. That's quite unhygienic in the first place. Second thing is, if you're ready to shower, of course you don't shower in cold water. Okay, shower in warm water. Make sure you dry your hair after that, and then that's perfectly fine for the first month, the confinement period. Now, can you drink water? Now, of course you can drink water, because you need water to produce your breast milk. You need water to replenish yourself. So, but usually in confinement, we recommend you to drink red daisy tea, because it's something that can replenish your blood as well as to hydrate yourself. Of course, once you finish your confinement tea or red daisy tea, then you still feel thirsty. Of course, you can drink water. And then again, of course, you don't drink cold water and drink warm water and still replenish yourself, hydrate yourself.
So what are some key dietary recommendations from TCM for postpartum women, and how do they contribute to the recovery and breastfeeding?
Okay, so there are a few, I would say, guidelines. First thing is, mix the cold. It means no cold, I mean icy cold stuff. For example, ice cream. For example, fruits directly out from the fridge. You can take orange out from the fridge, take it, it's extremely cold. So then, why do we always advise our patients not to take cold things? It's because cold and warm, they are energetics of the food. Cold will stagnate or move things slower. So TCM believes that when we take cold stuff, we actually stagnate or push down or lower our circulation of our energy within our body. In a way, we slow down the circulation of blood within the entire body, and that hampers recovery. So that's why we always advise patients not to take cold things during confinement period. Take warm stuff. So that's the second principle, which is that you need taking warm, soft, soupy stuff. We try not to chew on almond seeds. We try not to chew on hard things, So they try to take like soupy stuff, porridge, lentil soups. So this is something that usually recommended during confinement period for the dietary guidelines.
I see. So what role do herbal remedies and tonics play in TCM during the confinement period?
Okay, so as I mentioned, so herbs and tonic, we have this 28 days recovery confinement package that is comprised of herbs. Then after that, you brew it, then after that together with your meals, after that you consume it. So there are certain herbs that are, in terms of TCM, they replenish your vigor, that means your strength. There are certain herbs that boost up on your blood circulation to improve on the blood content within our body. Then after that, of course, they boost, in terms of biomedical perspective, they boost your iron supply within your body. So all these things are very important for your breastfeeding journey as well as for your postnatal recovery. Now, also on top of herbs, if we are having things like lactation insufficiency, in the acupuncture, certain TCM modalities can actually help as well. So there's a clinical study. They compare two groups of mummies. First group, both of them, they have lactation insufficiency, low breast milk. Then after that, the first one, domperidone. That's the common control. That's the common control that they use in the Western side. Domperidone, 10 mg 3 times per day. The other group, domperidone, 10 mg 3 times per day. On top of them, we use electroacupuncture. So acupuncture on one group, the other one no acupuncture, and we found out that after 4 weeks of treatment, prolactin increased, serum prolactin. VAS score increased, then as well as the infant baby weight increase as well, as compared to the conventional. So on top of conventional medicine, so this is where the TCM can actually come into place. Together with the conventional medicine, then this is where that we can actually improve on the prolactin as well as the breast milk supply. Now on top of that, of course, we need a good breastfeeding posture and practice. If not, just improving on the dietary wise is not forever efficient. So we need both sides of it together.
So what are some TCM practices that help new mothers regain their strength and vitality after childbirth?
Okay, so as I mentioned earlier on, so we use acupuncture, that's one thing. We also use scraping. So when we have mummies coming in to say that, they probably have a perceived low milk supply, or they probably have engorgement. So we refer to two things. One is deficiency, one is stagnation. So deficiency, as I mentioned just now, is the lack of fluids that probably lead to lactation insufficiency. Second thing, stagnation. Stagnation because of what? Emotion. I would say different parenting style from you and your spouse as well as you and your upcoming upper generations. So this stagnation will lead to mom having engorgement or perceived low milk supply. So that is where that acupuncture or rather TCM has to diagnose which group do you belong to, and then after that help you with your problem. So together with a good breastfeeding practice, it can actually help to improve the life of many mummies during this breastfeeding journey.
So the next thing we're going to look into is about postnatal depression, right? So what are the signs and symptoms of postnatal depression that both mothers and their loved ones should watch out for?
Yeah, good question. So because of what I've just said, mothers, they tend to get depressed because there are so many problems that they have to cope on their own, and they find it so overwhelming. So you have this what we call baby blues. That's very, very common. Mother become, feel helpless. They become tearful. They feel sad. They're not in a sad mood. And however, this one, postnatal blue, although they're very common, but they don't last very long. Fortunately, within 2 or 3 weeks, the mother will recover. She get experience and she can cope. So things get better. However, between 10 to 15% of mothers who might start with postnatal blue do not get better. They get worse. They can either get moderately worse, or moderate depression, or they can get very worse. They go into psychosis. And then that's become very dangerous because she can kill herself, she can kill her baby. So we have to be very alert, very careful. When a woman is in postnatal blue, we have to monitor them. So there's a way to monitor them. There is what we call the Edinburgh baby care scale. We answer 10 questions and then you give a mark. So you do it, say, even can do it before the delivery. Then you do it in the first week of delivery. Then do it about a month after delivery. And if the score goes up, you can see that this mother is in a risk of going into depression. They got to refer to a psychologist, refer to even a psychiatrist at the end of the day. So we need to be very alert and not miss out on this. So the family members will be the one that can help to help to observe. The psychologist, of course, will be the better person to assess her.
Okay, so Doctor, how can healthcare providers differentiate between baby blues and postnatal depression?
Yeah, so it's postnatal blue is mild, right? And it's common, so you cannot differentiate at this stage. So you need to see if there is a progression to depression, right? If you can see it's not getting better and it's gradually getting worse, and it seems like nobody seems to be able to help, and she feels she's helpless, then it's good first to refer to, say, either the patient consultant or to refer to the psychologist. And from there, you will then work out whether this is going to get serious or not.
I see. Alright, so what are some risk factors that contribute to the development of postnatal depression?
Okay, sometimes women, they have a history of psychiatric problem, right? You may have seen psychiatric problems, psychological problems, so they are at risk, right? If they go through a very bad labor, very bad pregnancy, very traumatized, that can also help to contribute to depression. If you have trouble with breastfeeding, some mother may feel it's so important to breastfeed the baby, and she find that she will not be a good mother if she cannot breastfeed the baby. Some mother, they may be very sensitive to this breastfeeding partner, and they can also contribute to the depression. So all this we have to watch, how the mother is performing in all these aspects as a mother.
So what support systems and resources are available for mothers experiencing postnatal depression?
Okay, right now, the only resource is if there's a lactation consultant, to refer to a lactation consultant, to the nanny, to the doula, or go to the GP. Either they go to the GP to alert the GP that there's this problem. So the GP can handle, can give us some this anxiolytic sedative and watch her. So if it gets worse, then we'll have to refer to the psychiatrist.
So how can partners and family members contribute to helping a mother who is struggling with postnatal depression?
Yes, so of course the spouse, the parents all play very important role in supporting the mother, and in fact the mother rely a lot on them as the first line, to seek the support and help. However, we have to be careful that sometimes the family members are affected by it negatively. They themselves feel depressed and they don't know what to do. So it's better to get people who are professional, who know what to do, to come in as early as possible.
So how do TCM practitioners work in conjunction with modern medical practices to provide comprehensive postpartum care?
So usually we need a diagnosis from the Western side, of course. So then after that, when they come in, we'll look at her and the entire body, the physical state, emotional state, then also the mental state of the mommy. Then after that, we diagnose her based on the TCM diagnosis, and then we prescribe herbs. We do acupuncture, we also do scraping, so that this can actually, in a way, help them in terms of what their mental conditions are. So also for postpartum depression, so also there are clinical studies to show that, one group without any treatment, the other group with acupuncture treatment. So they found that with acupuncture, oxytocin increase. The stress level, the stress anxiety level through a form increase as well. So there are actually a lot of ways that TCM can come into play at I would say a reduced or rather no side effect intervention. So I think that all in all, depending on what stage you visit the TCM physician, depending on what kind of condition, I think that we can all come in at different stages. So breastfeeding we can help, postnatal depression also we can help. So it depends.
Thank you so much, Mr. for the insightful sharing and all. And thank you, everyone. Yeah, is there anything else you want to add on and stuff? Okay.
I think TCM and conventional medicine can integrate. We have to understand each other better so that one will enhance the other. especially in cases where we need a lot of help. Some mother is very ill after delivery, mother with postpartum hemorrhage. In this sort of situation, I think if we can provide both TC and mention, it will help. It's very interesting to say that your clinical trial to show that the oxytocin goes up.
Right.
Oxytocin or prolactin?
Oxytocin. The first one was prolactin for the breastfeeding. Postpartum depression, that's the oxytocin.
So it is two hormones, oxytocin and prolactin. So therefore, oxytocin probably will have a lot of other functions that we do not know. Right? That is such a critical hormone during childbirth and after childbirth. It's something that we need to learn a little more. It's very interesting.
Yes, is there anything like any takeaway message or anything that you want to add on for those first time mommy especially?
Okay, so I think pregnancy and delivery and parenting is a shared responsibility as one. Then before we even get to the labor stage, during pregnancy, I think that mommy and daddy should get a common ground, or rather should know of a common consensus on how to take care of the baby in breastfeeding way, in terms of parenting, before the labor actually starts. Because a lot of times the labor comes in, the baby comes out, then after that, mommy want to breastfeed, daddy don't want. Or rather, daddy also okay, but then probably a third party say that no, the baby is losing weight. So then the daddy also scared. And then mommy want to breastfeed, but then she's helpless in this way. So she has to give in. When they give in, postnatal blues comes in, and after that, different problems comes in. So I think that this is very important. Then after that, of course, together with your caregiver, and as well as third thing is your nanny has to be sort of same common ground as you. So I think there's some very practical issues that are out of medical world, but then this is something that will affect your journey.
So education is very important, right? And education before pregnancy, during pregnancy, and education should be involved not just the mother, the husband as well, the father as well, so that the father knows what role he can play. And what he just said is that during this time when the mother needs help, and people are just giving their opinions, which are not based on any science or any evidence. Therefore, where are the professionals? Why are the professionals in there to support? So this is kind of a big issue, that they're struggling with what's the best thing to do. So this thing we have to look at it as that something needs to be done in society to help the mothers, not just leave it to a doctor or leave it to. It has to be almost at the government level, the Ministry of Health and the ONG, people to come with new policy on how to help the mothers. Otherwise, we're never able to get to them. This is what we're learning today, but we're still at a stage where there are people who are giving opinions when they are not well informed, and you're giving information to people who are suffering, who are want someone to help, and yet not the right person to help. So maybe every mother who wants to breastfeed must see a lactation consultant from the very beginning. Yes. Education from you to start off with.
Pregnancy.
Pregnancy.
So is there any timeline, exact timeline or time frame that they need to get ready to prepare to, what's the plan like and everything in your understanding?
I think during pregnancy will be the best time, because if you educate them a bit earlier, it may not be so. In the last trimester of pregnancy will be a good time.
So usually in my practice, I always recommend mommies to come around with 36. And I see their constitution, prescribe the herbs for them, and I also give them a little bit info on what to look out for during labor as well as breastfeeding. And after that, so that they won't be so confused.
Yeah, I always tell parents, always start, if you are keen to breastfeed, right, always start learning maybe from the second trimester onward and involve your husband or partner.
Yes.
And many times when I always tell them, can you imagine if you only start learning breastfeeding when the baby arrives? That is extra chaos, right? maybe on your arm crying, then you're trying to learn what's how breastfeeding works.
A bit too late.
Yeah, it's too late for that. But
right.
many parents actually do that.
Yes.
So
right.
that's why they find that it's very difficult, very difficult journey. So
Yeah.
always start early. During pregnancy is perfect. There's no baby to distract you, and you can absorb and learn better.
In a way, obstetricians are guilty about this because this is not in our training. This is not form the essential part of our counseling or advice given to mothers at all. Not at all, because by the time the baby is delivered, it's now in the hospital setting. It's no more in the clinic setting. And this is when things are happening and the doctors is not there. So it will depend on the hospital. And when we go there and do our rounds, we never even ask them whether any problem with breastfeeding. We only talk about your wound healing well, any pain there, So I think it's all very departmentalized. So we should come together. Like for example, three of us seeing a patient at the same time. Talking to the patient, discussing with the patient. I'm sure she will get a lot more confidence of what all the views are. We're all experts on what we're doing. Yeah. So I think this should be the future of going forward to help the mothers during their pregnancy and the postnatal period.
Alright. Thank you so much for all of you to share with the viewers out there, especially the first time mommy. Thank you so much. So insightful.
Thank you.
Yeah.
Thank you.
Thank you.
Thanks.